as I just speculated, and what that looks like for the competitive landscape of what the product would be able to do in the marketplace.
Yeah. There are a lot of rudimentary or crude devices. I mean, everybody asks about cold packs and hot pads and heating pads, and a lot of these are effective on a very small scale. And if you don't have a very large, a long duration issue, they can probably help you manage. But when you've got a chronic situation that needs to be controlled, and you don't want to get injure yourself, a lot of these people will be using heating pads on their tummies. They get what's called toasted skin syndrome because it can burn you. Then you have people that are sitting on ice. It's very uncomfortable. Again, I go back to, it's uncontrolled. It's not controlled. So what we bring is the ability to safely deliver in a range that is scientifically studied and known to be very safe, a manner of thermal delivery to your most intimate regions, to help with things like, think of mothers who are pregnant, who have hemorrhoids that they can't do anything about. They're going crazy. They can't go get surgery because it's not safe for the child. So they have to sit here and suffer in pain for weeks and weeks and weeks. We can help. That's just one indication we can help with. They're very difficult patients. Yeah. Men with prostatitis. I mean, they talk about sitting on golf balls or having a walnut, or it's hard for me to sit because the inflammation and the pain in my perineal area is driving me crazy. Hey, they can remove that pain with the cooling, and the cooling most times actually reduces the inflammation. Henceforth, is a snowballing effect of reducing the signals to the brain and stopping the pain. It puts them back in control, Darwin, of conditions and situations that are really difficult. There are others for females. There are a ton of them. And we talk about vulvodynia. We talk about, for both men and women, what's called pelvic floor spasmic syndrome. And a lot of these syndromes exacerbate other syndromes that just snowball out of control. So what we try to do is unravel that snowball and pull it back into control, and let the patients the patients, deal with their own conditions in the home, and treat their conditions, like I said, with the dignity that they deserve, because a lot of these conditions, these situations they're dealing with, and the solutions that they're